What a lot of people don't know about midwifery care is that we offer full spectrum women's health care. I see girls as young as 12, teaching them about what the menstrual cycle is like, premarital visits, teaching women about birth control. I also place IUDs, biopsies. I treat all kinds of infections. Pretty much anything related to women's health, I can help you figure out or refer you to the person who can. And half of my visits are a wide range of GYN visits, whether that be an infection, a cyst, a pain, really anything, a birth control consultation. And I love the variety. I love prenatal care, I love birth support, but I also love taking care of the woman as a whole throughout every phase of her life. We have an in-house GYN sonographer, so we're looking for cysts on the ovaries, endometriosis, PCOS, STD testing and treatment. We'll place IUDs. We can do, of course, cervical cancer screening, endometrial biopsies for endometrial cancer screening, all kinds of preventative health, immunizations. I do a lot of insurance, school, and work physical assessments. And so even though I'm technically an OBGYN care provider, midwives are also certified to be primary care providers. You can come in to me to get your school physical if you need. I love helping people get pregnant if that's what they choose. My husband and I struggled with infertility for years. We did every fertility treatment out there. I promise we did it. We did in vitro multiple times, and eventually we're blessed with a little girl. And so I feel such a personal connection to my patients who come in wanting education on that. And so it brings me a lot of joy to help and refer out and get to the bottom of that. I love to educate. I love to help people make informed decisions about their care, informed refusal about their care if that's what they choose. I want women to walk out of my office feeling more empowered than when they walked in, empowered to take control of their health care. I want them to feel empowered in the birth room. I want them to feel like they had a choice and they had a say and that they were respected and cared about, and that's all that matters to me. I had a patient reach out to me who told me that she had a really negative experience with her first pap smear. It was painful, it was violating, and just not a good experience. And so we just talked about education, and she messaged me and she said, I can't thank you enough for all that you taught me, because when I felt uncomfortable, I had the courage to speak up, the courage to tell them when it was hurting, and thank you so much for teaching me those tools. And I just knew, like, my job is done. Like, that's what matters to me. My name is Rebecca Helie, but I go by Becca, and I am one of the certified nurse midwives here at Seasons. I started my career as a labor and delivery nurse. I love the time spent there. I love women's health, but I was always so sad when after my 12-hour shift, I rarely, if ever, got to see my patients again. Something that I love about midwifery is that I can provide care from the time you start your period all the way through menopause, and I often get patients who come back. I always notice some things as a labor nurse, that, maybe I would do that a little differently, or kind of wondering what else was out there. And that really inspired me to pursue midwifery and everything that it represents. I got my bachelor's degree from BYU, Idaho in nursing. After gaining some experience as a nurse, I decided to pursue a graduate degree and got my master's degree at the University of Cincinnati. And then I did some clinical rotations here in Rexburg at family practice clinics and then at OBGYN clinics to gain experience, and then started here at Season. I have my mentors here. I love the physicians that I work with, Dr. Codd and Dr. Meredith. It's nice having them in my corner to consult with if I have a difficult case. It's nice to know that I'm supported by a high quality team. Most of my patients are low risk. I feel like I have a pretty good grasp on women's health in the birth scenario. As a midwife, I don't perform surgery. I'm not a surgeon. If any of my patients, for whatever reason, end up needing a C-section, like I had a patient who unfortunately was breech. I was able to consult with Dr. Meredith, and I can still participate in the C-section and assist and be part of her birth, but Dr. Meredith was the primary surgeon. In my postmenopausal patients who choose hysterectomy, I always will refer them to the physicians. High-risk pregnancies, I'm always consulting with the doctors, and we take a team approach. We're providing both the midwifery model of care with high-risk knowledge, and sometimes we integrate other specialties. I have a patient who's working with hematology or working with maternal fetal medicine in Idaho Falls. You can get the best of both worlds. You've probably heard the term midwife before. There's so many different kinds of midwives out there, and there's different levels of training. A certified nurse midwife has medical training, and they are authorized to practice in all of the 50 states. They have prescriptive authority in all the 50 states, and they can be independent practitioners. 96% of certified nurse midwives deliver in hospitals. Really, I can see any pregnant women. However, we are experts in low risk, normal physiologic birth. So midwives are great for people who want to practice shared decision making. Something that is one of the cornerstones of midwifery care is that shared decision making. It's my job to tell you the risks, the benefits, and what I recommend, and it's your job to make that decision, what's going to be best for your health and for your preferences, whether that be women's health or whether that be your birth experience. People who are aware of what a certified nurse midwife does are more likely to come see me, but sometimes people will see me by chance and learn about midwifery care. I have patients who go unmedicated and I give continuous labor support. I have patients who choose epidurals, and that's totally fine too. So I definitely see a wide range of patients, and one of the benefits of midwifery care is that personalization, that I'm able to tailor my approach to what each patient wants for her experience.